Hey guys, welcome back to Minus Breaks. This is all about the third part of the pregnancy video, So I never imagined that I'm gonna make three part for this pregnancy. It's all about goosebump moments because all these things are new to me. I'm not a father, I don't have a child or anything, but just the information I gather, I'm just expressing it out in order to make you all be aware about all these, because the persons who are interested in all these things, you must be aware about all these things, only then you can be a good father or a good mom. So let's see the cost. Regular prenatal checkups and necessary tests are crucial for monitoring the health of both mother and baby. In India, these expenses range from 40,000 to 2 lakh depending on healthcare providers. And if you go to government hospital, it will be less. And same way, what is the delivery? The cost of childbirth varies significantly based on the type of delivery and the healthcare facility chosen. Comes normal vaginal delivery, government hospital often free of charge. Private hospital, rural areas would be 2,000 to 5,000. Areas would be 30,000 to 1 lakh, depending on hospital amenities. And same is cesarean section, that is C section. So private hospital would be 25,000 to 2 lakh, influenced by the hospital reputation, location, facility provided. And postnatal care cost. After childbirth, postnatal care is essential for the recovery of the mother and the health of the new. These costs can vary widely based on individuals' needs and the chosen healthcare service. The main insurance plan in India offer maternity coverage, which can significantly reduce out-of-pocket expenses. Coverage typically ranges from 30,000 to 50,000 for delivery-related costs. And prenatal classes, engaging the prenatal classes such as prenatal yoga can cost between 2,000 to 5,000 per month, depending on the specialization location. So all those figures are approximate and can be so now we are gonna see how a partner must be really serious, So first, it's all about emotional support. You need to encourage your partner just like that. You have physical support, attend doctor's appointment, assist with household chores, encourage a healthy diet, help with exercise, be patient with sleep struggles. You need to have that patience. Plus, only the real loving husband can manage all these things. This pregnancy is not easy like you think. So be ready about all these things. And save a financial support and planning. Be ready about the money and save a preparation for labor and delivery, such as pack a hospital bag, learn about labor and birth, and be ready for emergency. All these things would be happening. Whatever happens, you must be positive enough. You need not be negative. The most important, postmortem support, help with newborn care, learn how to change diapers, soothe the baby, assist with feeding, support her recovery. She may experience postmortem pain, fatigue, or depression. Be understand, and you must care. Ensure she gets rest. Take turn with and night for the baby. Once your baby is delivered, husband, you cannot sleep. You need to wake for sure. You can't have a sleep for. You need to carry a wife and you need to carry a baby for sure. You need to be mentally prepared. Only then this particular pregnancy and all those things would be. So what are the essential things you need to buy before a baby is born? Newborn baby clothing, that has one size bodysuits, sleepers, rompers, and caps, swaddles, blankets, and baby feeding essentials like baby bottles, breast pump, bub clothes and bibs, sterilizer for the diaper needs like newborn diapers, wipes and rash cream, changing mat, diaper bag, and same way sleeping essential like baby crib, bassinet, mattress, fitted sheets, blanket and sleep sacks, and white noise machine. Bathing hygiene essential like baby bath hub, baby shampoo, body wash, soft towel, washcloths, baby nail clippers, cotton balls, and earbuds. And same way healthcare safety like thermometer, nasal aspirator, first aid kit, monitors to watch over baby while sleeping. Seat mandatory for travel, store or baby carrier, portable changing pad, and mother's postmortem essential, maternity pads, comfortable nursing clothes, pain relievers, and sliss bath. So many couples struggles with not having children due to various biological, medical, lifestyle, and essential factors. Let's see about all these things also, because suddenly couples fight and get divorced even because of all these reasons. I don't know why. Because love is most important rather than the baby. I would say more than baby, love is important. If you get baby, that's your luck. If not, you need to follow certain procedure, and if you follow certain procedure, you might get baby if you have money, or else you need to love each other and just move on in life. That is all about life, right? So let's see what are the factor. First comes medical and biological reason. Infertility. So first, it's all about female infertility. That is PCOS, polycystic ovary syndrome, affects ovulation. Endometriosis, uterine tissue growth outside the blocked fallopian tubes, prevents egg sperm meeting. And next, hormonal imbalance, low estrogen or progesterone. Menopause, ovary stops functioning before age of 40. Same way for men. Low sperm count or poor mortality. Same way hormonal issues, low testosterone. Same way enlarged veins in the testicle, erectile dysfunctions or ejaculation issues, and same with genetic or unexplained reasons. Some couples face unexpected infertility where medicinal tests don't identify the exact causes. So, lifestyle environment factors such as unhealthy diet and lack of exercise, stress and mental health issues, smoking, alcohol, drug use, late marriage and delayed pregnancy, pollutants and chemicals, and same with financial and social reasons. It's all about career priority, financial struggle, personal choice. This may be the reason to. And same pregnancy losses, medical complications, miscarriages and high risk pregnancy. Because of health issues you might be getting all these things. Same with social relationship issues, marital conflicts, cultural and religious beliefs. So what are the solutions for infertility? Medical treatments such as IVF, IUI, fertility medications or surgery. So lifestyle changes like healthy diet, exercise and stress management can be made, and adoptions or surrogacy can be made so that you can feel happy, right? So all these are the option which you can do. So you would be seeing IVF, now you would be seeing IUI. What is IUI? That is intrauterine insemination. That is, so IUI is a fertility treatment where sperm is directly placed into the uterus during ovulation to increase the chance of pregnancy. It is less invasive and more affordable alternative to IVF. How does IUI work? First, ovulation tracking. The doctor monitors a woman's menstrual cycle to identify the best time for insemination, usually around ovulation. In some cases, fertility medications are given to stimulate ovulation. So next, it's all about sperm's preparation. The sperm from the male partner or donor is washed and considered to select the healthiest ones. This increases chance of fertilization. Next, it's all about sperm insertion to, and next it's all about sperm insertion to uterus. This process is painless and takes only a few minutes. And waiting for fertilization. After insemination, the sperm travels to the fallopian tubes to meet the egg. If fertilization happens, the embryo implants into the uterus, leading to pregnancy. So, who can benefit from IUI? Couples with mild male infertility, low sperm count or mortality, unexplained infertility. Reasons for infertility is found: cervical issues, mucus problem preventing sperm movement, same-sex couples or single woman using donor sperm, ejaculation issue in men. So it's not suitable for women with blocked fallopian tubes. You have male infertility, very low sperm count or poor quality, or older woman above 40 with poor egg reserve. All these factors, all these important factors are there. So pregnancy is not easy. To get a baby is not easy. So once you get a baby, you need to look after that baby, you need to have money. And if you don't have baby, the society, you need to fear, and all these things you need to discuss. The society would never give you all this happiness. It's you and your partner must decide your happiness. The love must be there, no matter you're pregnant or not. So let's see the difference between IUI and IVF. Process: sperms directly placed in uterus, that is in IUI. In IVF, egg and sperm combined in lab, then embryo placed in uterus. The cost is 10,000 to 30,000 per cycle for IUI, and same with IVF, that's like 1 lakh 20 to 3 lakh per cycle. And same with success rate is 10 to 20% per cycle, that is in IUI, and same with 40 to 60% per cycle in IVF. And it is best for mild infertility in IUI, and same way in IVF it's for severe infertility or failed IUI. See the difference between normal delivery and C-section. Baby is delivered through birth canal naturally. In C-section, baby is delivered through surgical incision in the abdomen and uterus, and contraction help push baby out naturally. Doctor may assist using forceps, or surgery is performed under anesthesia. A cut is made in the lower abdomen and uterus to remove the baby. And the pain, pain during delivery, intense labor pain. See, if you have there's a chance that your baby might be healthy or not. So the recovery time will be faster, that would be 4 to 6 weeks, but in C-section it would be like 6 to 8 weeks. And the hospital stay would be for 1 to 2 days for normal delivery, and for C-section it would be 3 to So what would be the pain? Less compared to C-section, more pain due to stitches and abdominal surgery for C-section. That's the difference between normal delivery and C-section. So what are the benefits? And baby gets beneficial bacteria from the birth canal, boosts immunity, that is for normal delivery. C-section suitable for complicated pregnancy, lower risk of vaginal injuries. So what are the risks? Perineal tear in vaginal area, painful contraction. Same way in C-section, infection risk, blood loss, longer recovery and restricted. So when is C-section necessary? Baby in breech position such as feet first instead of head first, multiple babies, twins, triple, etc. Placents prevail, placents blocks the baby heads too large for vaginal birth, previous C-section delivery, medical conditions such as high blood pressure, diabetes, heart issue is the reason. So if there are no complications, normal delivery is usually preferred because of its faster recovery and fewer risks. C-section is life-saving in high-risk pregnancy but has a longer healing period. So the third part of the video is coming to an end right now, and the last part of the video would be the final part, because I just thought that I can finish in 3 parts, but the fourth part is really required so that it would end in a complete way. So with the thought of this video, take care, have a great day.